We turn now to the fight against COVID, and the city of Beaumont tonight reporting 422 new COVID cases.
That's right, but as we enter calendar year 3 in the pandemic, we know it's not just the sheer number of cases that we watch for, it's actually the hospitalizations. There are 148 COVID patients here in Jefferson County, but as you can see, most of them are being treated in regular rooms and not the ICU.
Now, regionally, the picture is a bit more challenging. The COVID hospitalization rate hovering right around 30%. That's what that line on your screen tracks. At this point, roughly 1 in 3 people in the hospital has COVID. So no doubt, these numbers have certainly started to strain our hospitals. 12 News reporter James Grant is live tonight with how they're dealing with this latest surge and how long it could last.
Yeah, Letitia, Jordan, one doctor says this latest surge is similar to the Delta surge and that we could, be out of the woods in a matter of weeks, but it's still leaving hospital staff stretched thin.
This variant is just like a wildfire, and we have a lot of people getting sick.
Dr. Kamar Arfin with Baptist Hospital has been on the front line of this pandemic. He's the COVID-19 unit lead at Baptist Hospital. So how does the Omicron surge compare to the Delta surge when it comes to patients in his hospital?
In any given day, we're seeing more sick patients than what we saw with Delta.
Dr. Arfin says the ICU at Baptist Hospital is at capacity, and a majority of those in the ICU are unvaccinated. He says this is a concern for hospital staff.
We're just hoping that it just goes away quickly, that it does not, jeopardizes our, us taking care of patients who don't have COVID or who are staying away from the hospital or delaying their elective surgeries.
As Southeast Texas hospitals like Baptist are filling up with COVID patients again, there are outside facilities doing their part to alleviate the burden. This includes Mid-Jefferson Extended Care Hospital. CEO Nikki Robbins says they have 2 facilities, one in Beaumont and another in Nederland, each one being used to treat overflow COVID patients. According to Robin, the Beaumont facility, which started taking COVID patients last week, is already at capacity, but the state is sending additional nurses and respiratory therapists to help with the surge. Dr. Arfin says while the high hospitalization numbers may continue for a few more weeks, we could soon be out of the woods when it comes to the Omicron surge.
If we have most of the people are infected, and just like with Delta, it lasted 6 to 8 weeks, I believe it may be more or less the same, or hopefully probably a little bit less than what we saw in Delta.
Dr. Arfin also says this latest surge comes during the winter, a time when hospitals normally see more patients due to the flu and other illnesses, so it is unfortunate timing. Live in Beaumont, James Grant, 12 News.